Hello, my name is Dr. Joseph Lawrence. I'd like to thank you for ordering this information regarding peripheral neuropathy. Peripheral neuropathy basically means damage to the peripheral nerves. The peripheral nerves are the nerves that leave the spinal cord and supply structures of the body such as the skin, muscles, and internal organs. There's three types of peripheral nerves. There's motor, sensory, and autonomic nerves, which control the heart and other internal organs. Damage to the motor peripheral nerves can cause muscle weakness and fatigue. Damage to the sensory nerves can cause fairly bizarre symptoms such as burning sensation, ice sensation, cold, prickly, stinging. The diagnosis for peripheral neuropathy is commonly missed. In fact, most individuals are told that it's nothing they can find that's wrong with them or it's all in their head. But when evaluating peripheral neuropathy, we attempt to make sure that we leave no stone unturned for this more than common symptom. For example, what we do is we evaluate this neurologically as well as metabolically. And first of all, the neurological causes of peripheral neuropathy can involve what's known as nerve entrapment. For example, if there is nerve entrapment or compression of the nerves leaving the lower lumbar back, this might cause some of these symptoms as described in the legs and or feet. As well, this can occur in the lower part of the neck where compression of the nerves may cause burning, tingling, or numbness or weakness in the arms and hands. Another very overlooked issue as well with the neurological evaluation of peripheral neuropathy is parietal lobe dysfunction. Now, the parietal lobe in the brain is where the sensory input is processed, and if there's weakness in this parietal lobe, one may also experience burning, numbness, tingling, as well as weakness as a result of this lower function of the parietal lobe. Now, our approach to this sort of thing is we can use very safe, advanced functional neurological techniques to help increase the frequency of firing of that area of the body, which in turn can help to abate the symptoms that were described. As well, one has to look at the metabolic factors regarding peripheral neuropathy. And some of the more common causes are insulin resistance, autoimmune function, statin drugs, and toxicity. When it comes to insulin resistance, one has to understand that this is a problem with glucose metabolism. The nerves in the human body require three things to function properly: oxygen, glucose, and stimulation. And it's very important to make sure that the testing that's done is going to evaluate whether the individual has this type of glucose problem. The autoimmune issue is very important because the body's own immune system may be attacking the peripheral nerves, and this can be due to a number of factors such as gluten sensitivity, sensitivity to proteins of dairy products, soy and egg, for example. And this also might cause gut problems whereby an individual may be deficient in vitamins B1, 6, 12, and vitamin E. Again, these are all related to peripheral neuropathy, and evaluation of the gut and the autoimmune functions has to be done. Finally, statin drugs. Now, statin drugs are drugs that are used to control cholesterol levels, and some of the side effects of statin drugs are in fact peripheral neuropathy, so this has to be taken into consideration. And last but not least, one of the top factors is toxicity. An individual may be exposed to certain toxins that have to be measured by certain testing, which may be influential on their symptoms. When we go about the treatment of peripheral neuropathy, we make sure that we'll look at it neurologically and metabolically in order to give the best approach that we think that can help to give you some long-lasting relief from your problems. If you require any further information on this, we'd be happy to answer any calls to our office, and we certainly hope that you don't have to suffer anymore, and we certainly hope that we can help you. Thank you.